All right. Yeah. Summer, how are you doing?
Very excited.
Very excited. So
yes.
So explain what are we having done? Why are you having this done? And in case people don't know, Summer is the office manager, operations director here at Regenerative Treatment Centers. And I know some of your background is you've been dealing with some extreme joint pain, correct?
Yeah, I hurt my knees. I've had like 3 knee surgeries. Meniscus tear, an ACL tear in each knee, bucket handle cartilage thing that was making my knees stay out of joint. So I've struggled with my knees for a long time, and I've recently been starting to work out again, and I'm trying to do some physical therapy stuff. And so it's serendipitous that I get to work at Regenerative Treatment Centers because we're going to inject my knees. We're going to start with PRP today, and then I'm going to get stem cells in my knees probably in a month or 2. We're going to try to really heal this cartilage and the torn meniscus and get me to a place where I don't have pain anymore, and hopefully have space open up in my knees again. And
so I know, Summer, the one thing that we never ask a woman is how old they are, but the only reason I'm asking this is how long have you been? You said you've had 3 surgeries on your knees. So how long? Like, it's knees and ankles, and I'm going to show. How many years have you been suffering from the joint pain? I mean, you've got.
It's been since I was in high school. My first ACL tear was in high school. And then I tore the second time in college, the other knee.
Wow.
Shouldn't ride 4-wheelers or skateboards, I'm just saying.
Well, you should. You just shouldn't hurt yourself doing it, right?
Yeah.
So, all right.
So I'm excited to get healing.
Yes, and so we have
I'm thankful.
Michaela here, our nurse practitioner.
Hello. All right, so we're gonna go ahead and jump in. So you're just gonna feel me touching. I'm just feeling for my landmarks so I can find that joint space in your knee. And all we're doing is injecting that PRP with ozone into that joint space. Use the ultrasound just to verify. Okay. Get the site cleaned and prepped.
And the PRP, what exactly does it do?
So it's platelet-rich plasma. So it's got growth factors in it that can help with inflammation around that joint. So that's number 1. Number 2, we're talking about doing stem cells for you down the road here. So this PRP will help to prepare the area, give it some scaffolding for when we do that stem cell injection. It's going to help give those stem cells something to grow onto and hold onto. So first inject the PRP, and then you'll see me following up with the ozone. So 1 injection, you don't have to get poked twice.
So that's a little bit different. Most clinics just do a PRP, injection or just a stem cell injection, but we're doing ozone along with that, correct?
Right.
And what is that ozone doing specifically? Obviously that's a little bit different than most places.
Well, the ozone's helping to oxygenate the joint.
Perfect.
Yeah. Do you have to dub me or something? Big breath. Good job. So you might feel some pressure.
Yeah.
Doing okay?
Mm-hmm.
It's a lot of pressure. So you removed the PRP.
This is
Syringe.
the oxygen, or the ozone, ozone. And you're gonna feel more pressure.
So that ozone is basically it's oxygenating the mitochondria of the cells that are in that joint space, right?
Correct.
And so by doing that, it increases vascularity.
Should I move it?
You can move it. Okay. Big breath.
Doing awesome, Summer.
A little bit more. Do you feel like you have swelling like around your ankle and do you feel like you get more swollen on that foot?
I mean, yeah, the foot's always bigger than the other foot.
I know. So I'm just going around the joint over here.
Woo.
Yep, all the pressure.
How you doing, Summer?
Doing okay.
Doing all right.
Hurt a little bit, but
What's
I have
the
pretty messed up knees, so.
yeah.
Yeah.
So what was the main feeling that you had? Obviously, you felt some pressure going in.
Yeah.
So everyone's different as far as pain. I have people that have no problems with the injection and feel totally normal, and then I have people where it's really uncomfortable, they feel the pressure, and anywhere in between, and it's really hard to determine who's going to have pain and who's not. But the patients that do complain of pain, they usually say within about 20 to 30 minutes they start to feel better, and everybody walks out of the office just fine and feeling much better. So, pain is part of it, but it does go away.
Awesome. And I would say that the benefit of that pain is knowing that we're doing something to regenerate something.
Right.
So how are you doing, Summer?
It was painful, but I am excited to help. I just know I've seen so many of our customers come in now, or patients, and it's completely changed their life. So I'm excited to have my life changed too.
And I mean, you said you've been dealing with this for,
Since high school.
Since high school. I mean, that's
and I'm 38.
That's 20
years.
20 years. So don't say anything. But I mean, you've had a lot of degeneration and arthritis. Obviously.
Yeah, they said I'm guaranteed to have arthritis and I've kind of just taken it easy on my knees. I stopped playing sports, but I know that it's there. So.
Yeah. Well, we're excited to see your journey and see the progress.
Yeah.
Yeah.